Hello learners! Did you know about the rotator cuff? So keep an eye out and learn about. The rotator cuff is also known as musculotendinous cuff. It is a group of muscles and tendons that surround the shoulder joint and strengthen its capsule. It holds upper arm in place and shoulder by keeping the head of the humerus bone firmly within the shallow socket of the shoulder blade, scapula. It helps in make all the motions of arm and shoulder. In this article we shall look at the anatomy of the rotator cuff. The head of humerus bone fits into the glenoid cavity of shoulder blade, or scapula. When extend arm out away from body, the rotator cuff muscles keep it from popping out of the glenoid cavity. All four muscles of rotator cuff originate from scapula, but the insertion of the muscle leads to different parts of humerus bone. Each of them works in a specific motion of shoulder. Supraspinatus muscle. Supraspinatus is responsible for movement away from the center line of body, abduction. The supraspinatus produces about the first 15 degrees of motion. After that, deltoid and trapezius muscles take over. Infraspinatus muscle. Infraspinatus is the main muscle responsible for a lateral rotation of your arm away from the center line of body. It's a thick triangular muscle. It covers the back of scapula deep below the skin. Teres minor muscle. Teres minor is a small narrow muscle on the back of scapula just below the infraspinatus. It also contributes to lateral rotation of arm. Subscapularis muscle. Subscapularis is a large triangular-shaped muscle that lies below the other three. It's the strongest, largest, and most used of the four rotator cuff muscles. It participates in most shoulder motions, but is especially important for rotation of arm toward the midline of body, medial rotation. Unlike the other three muscles, the subscapularis attaches to the front, not the back, of humerus. Each of these four muscles attaches to the upper part of humerus at a different point. From top to bottom, the acronym SITS can help in remember these four muscles: Supraspinatus, Infraspinatus, Teres minor, Subscapularis.